Good evening. I'm Amy Donnellan, and I will be discussing full practice authority in the state of Ohio. In order to describe the process of the full practice authority in the state of Ohio. The Institute of Medicine 2010 landmark report, The Future of Nursing, Leading Change Advancing Health, called upon to fulfill and expand the potential as primary care providers across practice settings based on their education and competency. Nursing initiatives and programs should be scaled up to help bridge the gap between insurance coverage and access to care. They should be full partners with physicians and other health professionals in redesigning healthcare in the United States. Earlier this year, 20 states, most recently Nebraska and including the District of Columbia, have enacted full practice authority for nurse practitioners, both practicing and prescribing independence. Additionally, the Veterans Affairs System has proposed changes to the Nurse Handbook. The proposed change is being driven by the use of resources to decrease variability in care provided by APRNs through the VA system. The proposed change will increase access to care and ensure continuity of the highest quality of care for their veterans. As an integrated federal healthcare system, the proposed policy parallels current policies in the Department of Defense and Indian Health Service. A significant number of states have already approved full practice authority for NPs and CRNAs, with many VA medical centers successfully utilizing APRNs to the full extent of their education and training. APRNs receive extensive education and clinical training as part of their degree programs and are then required to pass rigorous national certification exams to demonstrate their knowledge and competency. Decades of empirical evidence and research show that APRNs are vital members of the interprofessional healthcare teams as they help ensure access to care, provide care to the utmost quality, and can assist in reducing healthcare cost. Moreover, APRNs practice in a diversity of healthcare settings and are often depended upon by underserved communities as the sole advanced practice clinician. The Federal Trade Commission, the Institute of Medicine, the National Governors Association, and other policy bodies have noted the high quality of APRNs and the impact it is on healthcare competition but access to care. There has been a significant march towards full practice authority in the state of Ohio. The Ohio Association of Advanced Practice Nurses, OAAPN, it's their goal to obtain full practice authority for the state of Ohio. Current Ohio law mandates that APRNs need a collaborative agreement with the supervisory physician in addition to an inclusionary and exclusionary formulary. Unfortunately, this law prohibits APRNs from practicing to their full extent of education, training, and certification. There are actually 26 states with full practice authority for CNMs, and 33 states are independent practice states for CRNAs, with no state supervision requirement in state law. 17 of them have also opted out of the federal supervision requirement. Since Ohio does not have full practice authority for any of their APRNs, OAAPN is seeking FPA for all APRNs together. Allowing full practice authority for APRNs would remove unnecessary and burdensome oversight that hinders access to services. However, this requires the Ohio General Assembly to grant APRNs full practice authority, and it is a critical component in this endeavor. OAAPN, along with all of Ohio's APRN organizations, seeks to modernize the Nurse Practice Act. The OAAPN organization formed a full practice authority committee. The committee has crafted FPA legislation and has received 2 legislative sponsors. They are in the process of obtaining a bill number in order to introduce the FPA legislation in the 131st Ohio General Assembly. The committee has secured the support of important stakeholders such as the American Association of Retired People and Ohio Nurses Association. They have recruited members to educate Ohio legislators, and many OAAPN members have already volunteered to serve as contacts for their members of the General Assembly. The program is called the Key Person Program, of which I am a member of. They have also commissioned an economic analysis by the prestigious RAND Corporation that clarifies the potential for substantial financial savings available to the state of Ohio by the elimination of the APRN restrictive practice laws. In addition to the FPA legislation, another important legislation that could reduce APRN barriers is the reintroduction of the delegation bill, House Bill 96. The delegation bill was reintroduced and has a new bill number. The delegation bill is to authorize APRNs who hold a certificate to prescribe to delegate to an unlicensed assistant personnel, for example, medical assistants, to administer certain drugs such as nebulizers, enemas, and immunizations. The American Medical Association continues to be an obstacle. The medical society leaders have taken a number of steps that include strengthening their lobby capacity, working more closely with specialty societies, stepping up their fundraising and campaign contributions, fostering strong relationships with key legislators, and keeping the focus solely and relentlessly on patient safety. In addition, they've worked with other national medical organizations through the Scope of Practice Partnership and launched a national truth in advertising campaign. However, most recently in North Carolina, there was a Supreme Court ruling that could limit medical board authority. The state medical boards may find it harder to fence off the practice of medicine from non-physicians, example, nurse practitioners. In the wake of the Supreme Court decision in a case about teeth whitening, the High Court ruled that the North Carolina's Dental Board violated the Sherman Antitrust Act when it shut down non-dentists who were whitening teeth in malls and beauty shops because the board, composed mostly of practicing dentists, was not actively supervising. The ANA, AANP, AANA, ACNM, and AACNS rallied behind the Federal Trade Commission in the Supreme Court case because these associations said that active state supervision was needed for physician-dominated medical boards because they have a history of unfairly limiting the scope of practice for nurses. Additionally, the American Association of Retired People have a public policy document that supports APRNs and discusses removing barriers for advanced practice nurses for hospital privileges. The document also addresses Medicare regulations that prevent APRNs from conducting patient exams in hospitals, as well as state laws a barrier for APRNs and their patients. The OAAPN had developed a key person program to address resistance and increase the level of support amongst our local representatives. OAAPN had a RAND study performed to show the impact of full practice authority for Ohio APRNs. The RAND study showed that removing restrictive scope of practice laws could lead to approximately 70,000 fewer ED visits in the state, which could also result in significant savings of Ohio due to the high cost of ED visits. The OAAPN estimates the cost savings would be in the millions. Additionally, if we look at Medicare and Medicaid fee schedules for the state and data outlining the difference between the cost of ED and primary care visits, this translated into significant savings. It also could save millions of dollars for Ohio residents and Ohio healthcare insurers. As many as 1.5 million Ohio residents would potentially report better access to care, and within 1 to 2 years of changing the scope of practice laws, an estimated 330,000 more Ohioans could receive preventive care. Now, the study did highlight that some groups, such as the AAFP and AMA, caution against full practice authority because they argue that patients prefer to see physicians rather than APRNs. An expanding scope of practice could lead to increased cost, arguing that nurse practitioners order more lab tests, imaging, and specialty visits. However, the response to this concern simply isn't accurate, as the safety of our patients is our top priority. And we would continue to work closely with our primary care physicians and specialist colleagues to ensure health and safety for our patients. On April 2nd, I met with House Representative Jonathan Deaver, District 28, of Coffee Please in Madeira. We established common ground as both of us have children at the Madeira Elementary School. I discussed 4 topics during our meeting: APRN roles, key person program, full practice authority, and House Bill 96. He was aware of APRNs and shared that there were 3 physicians in his family. However, I described what each APRN could do and the impact APRNs could make if they were able to fully practice to their fullest extent of their education and training. I also provided 2 pamphlets, Get to Know Your APRN and If I'm Sick, What Are My Options? I described the key person program, that I was willing to volunteer 4 to 8 hours of my time per month to meet with local representatives, write letters, be available for questions or clarification regarding legislation that impacts APRNs, as well as testify if needed. I also provided the RAND study results and how Ohioans would benefit from APRN's practice. Since the FPA legislation hasn't received a bill number, I discussed House Bill 96. The bill was reintroduced in the 131st Ohio General Assembly, and this bill would remove barriers and increase access for patients who are seen in clinics with medical assistants. I explained that House Bill 96 would amend sections 4723.07 and 4723.48 and to enact section 4723.489 of the revised code to authorize a person not otherwise authorized to do so to administer certain drugs pursuant to delegate by an APRN who holds a certificate to prescribe. The primary sponsor is Representative Dorothy Palinda and Representative Heather Bischoff. The bill is currently in the House Health Aging Committee, and I printed out the bill summary, highlighted the requested sections for the amendment, and provided this for him during our visit. Surprisingly, we met for a little over an hour, and the meeting overall went well. We did establish common ground and spoke of our children as well as the funding for schools, and we discussed the deficit of Medicare and Medicaid, and what the state of Ohio wants to do is to take $15 million from the school funds to decrease the Medicare-Medicaid deficit. He also explained that he was an attorney and had several physicians in his family. I noticed that this may be an obstacle or a barrier because I'm not sure of the position of his family and their perspective on APRNs. However, when I reviewed the House Bill 96 bill, I think he knew that I was aware of the bill, and he started understanding that I knew the stages of what a bill goes through in order to become law. Therefore, he began giving me names of lobbyists, of potential opponents he might be thinking was the American Medical Association, the AAFP, and AAO. And he discussed the potential need for a RAND report. However, when I explained that OAAPN had conducted the RAND report for the Full Practice Authority, that this bill was just a slight component of what removing our barriers and scope of practice could enhance, and that we could save millions of dollars for if the FPA could potentially, if it would be passed. He did make a comment that someone knew what they were doing and had went about getting the RAND report the right way. When we left, we stated we look forward to working with each other in the future, and told me to contact him as soon as possible. So thank you so much for this great opportunity. Thank you.